Abled Alert, Outbreak, Emergency, COVID-19 Coronavirus Pandemic. Ongoing coverage, copyright 2020, Abled.com Networks. This is the Abled Alert COVID-19 Coronavirus Briefing for the week of May 4th. Image. Global map showing red dots in various sizes showing the extent of the COVID-19 infection around the world. Total cases confirmed, 3,710,380. Active cases, 2,218,995. Total deaths, 256,920, an increase of 5,943 in the past 12 hours. Total critical cases, 49,329, a decrease of 579 in the past 12 hours. Total recovered, 1,235,477. That's an increase of 55,881. Featured alerts. Abled Alert module. Can C19 reinfect? We are truncating the name COVID-19 as C19 in some cases for brevity. Image. An African-American couple sits together on a sofa. He is holding a tissue while she holds a thermometer. Studies out of China and reports from Japan and South Korea are producing frightening headlines about recovered COVID-19 patients testing positive for the new coronavirus after being discharged. Should we be worried? Is it a reinfection? Is it a relapse? Is it a virus mutation? Or is it a result of a mistake in testing? Many questions have popped up in the wake of those worrisome headlines out of Asia. Anecdotal reports from separate friends in California report symptoms similar to coronavirus infection that occurred in late November, early December, that went away and then reappeared a few weeks later in January. This without the benefit of testing to confirm or rule out if it was the SARS-CoV-2 coronavirus. It's also a virus that impacts different people in different ways. Some have mild symptoms for a day or two, while others are flat on their backs, out of commission for a week or two. And some who don't show any symptoms or ill effects have tested positive, meaning that until that test, they can be invisible super spreaders. In either scenario, the prevailing wisdom is that the body would be building antibodies to the infection within a week to 10 days after infection. A number of infectious disease experts say testing positive after what seemed like a recovery could be the result of a false negative and that the patient is still infected. Residual RNA from the virus could be another source of a positive test result post-recovery. And it's also possible the virus becomes latent elsewhere in the body after a high immune response, only to rise again, quote, when the coast seems clear, end quote. As more time goes by in this pandemic, researchers will hopefully be able to compile more definitive data. Hilary Leung has examined this in more detail at Time.com, including data results from Shenzhen, China, where almost 15% of coronavirus patients tested positive after they were discharged. You can read more of our coverage at Abled.com and find links to those sites in the downloadable PDF or on the website. Abled Alert module. Allergies, flu, or C19. Image. A middle-aged woman sneezes into a handkerchief in an outdoor garden near some flowers. The global COVID-19 pandemic has collided head-on with cold and flu season and is now spreading well into allergy season. The dilemma for many people is how to tell the symptoms apart. We compare them below. In this mashup of cold, flu, and now allergy season, the biggest symptom a cough or sneeze may trigger is fear. Fear that it's COVID-19. Because so much is unknown about the new coronavirus, possible symptoms are evolving as the pandemic spreads and more cases are treated by doctors. Dr. Bruce Aylward of the World Health Organization told NPR that 90% of COVID-19 patients have a high fever as an early symptom and 70% have a dry cough. Quote, "It's not the sniffles," end quote, he says. "It's not a runny nose. That can be a symptom, but that's rare." Spring has come early for the estimated 19 million allergy sufferers in the U.S., and with it, a paranoia that their usual seasonal symptoms of red eyes, a runny nose, scratchy throat, coughs, sneeze, and body aches may be the signs of the more sinister coronavirus. On the following page, we've placed a symptoms map compiled by the Asthma and Allergy Foundation of America, AAFA, based on shared data from the CDC and the WHO, World Health Organization, that differentiates symptoms between conditions. ABLED is a registered international trademark and wordmark of the Laura and Wagner Foundation. All rights reserved. Allergies, cold, flu, or COVID-19. The symptoms map shared below from the Asthma and Allergy Foundation of America consolidates data from the World Health Organization and U.S. Centers for Disease Control, and does not include more recent anecdotal reports of gastrointestinal pains and loss of appetite and loss of sense of smell, although researchers are reporting the last two are affecting up to 60% of those who test positive for the coronavirus. In the colored chart, the columns are listed from left to right. Symptoms: coronavirus, COVID-19 symptoms range from mild to severe. Cold, gradual onset of symptoms. Flu, abrupt onset of symptoms. Seasonal allergies, abrupt onset of symptoms. Length of symptoms, 7 to 25 days for coronavirus. Less than 14 days for cold. 7 to 14 days for flu. Several weeks for seasonal allergies. Symptom: cough. Coronavirus, common, usually dry. Cold, common, mild. Flu, common, usually dry. Seasonal allergies, rare, usually dry unless it triggers asthma. Symptom: shortness of breath. Coronavirus, sometimes. Cold, no. Flu, no. Seasonal allergies, no. Symptom: sneezing. Coronavirus, no. Cold, common. Flu, no. Seasonal allergies, common. Symptom: runny or stuffy nose. Coronavirus, rare. Cold, common. Flu, sometimes. Seasonal allergies, common. Symptom: sore throat. Coronavirus, sometimes. Cold, common. Flu, sometimes. Seasonal allergies, sometimes, usually mild. Symptom: fever. Coronavirus, common. Cold, short fever period. Flu, common. Seasonal allergies, no. Symptom: feeling tired and weak. Coronavirus, sometimes. Cold, sometimes. Flu, common. Seasonal allergies, sometimes. Symptom: headaches. Coronavirus, sometimes. Cold, rare. Flu, common. Seasonal allergies, sometimes, related to sinus pain. Symptom: body aches and pains. Coronavirus, sometimes. Cold, common. Flu, common. Seasonal allergies, no. Symptom: diarrhea. Coronavirus, sometimes. Cold, no. Flu, sometimes for children. Seasonal allergies, no. Footnote: information is still evolving. Allergies, colds, and flus can trigger asthma, which can lead to shortness of breath. COVID-19 is the only one associated with shortness of breath on its own. Sources: Asthma and Allergy Foundation of America, World Health Organization, Centers for Disease Control and Prevention. The previous chart doesn't include symptoms that may mimic a heart attack, which have evolved out of two studies, one in China and one in Nebraska. You can read more about that in our Heart Attack or C19 report at ABLED.com. Update: data scientist Seth Stephens-Davidowitz has written in the New York Times opinion section that Google searches for loss of smell and eye pain or burning eyes have correlated with the rise of COVID-19 diagnoses in geographic hotspots. He said the data showed that searches in Italy for burning eyes were 5 times their usual levels in March and above 4-fold in Spain and up 50% in Iran, and that the condition could be considered symptoms of the coronavirus. However, none of this has been confirmed by health officials. Other data points out that sneezing and a runny, stuffy nose is one symptom that largely differentiates cold and allergies from COVID-19. Another differentiating symptom, according to the AAFA graphic, is shortness of breath. People suffering from shortness of breath could be a sign that they have COVID-19. Allergies, cold, and flu can trigger shortness of breath for those with asthma, according to AAFA. Regardless, anyone developing chest pains and/or shortness of breath should seek immediate medical attention. COVID-19 related headlines. Abled Alert Module. Image shows cans of Lysol spray on a shelf in a store. Lysol issues warning. Do not drink disinfectant or bleach or try to inject it into your body. What's prompted the warning? U.S. President Donald Trump conjecturing out loud about the possibility of getting disinfectant or UV light inside the body to kill the SARS-CoV-2 virus that leads to COVID-19 disease. Jaws dropped when the president said, quote, "I see the disinfectant where it knocks it out in 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning," end quote. Even Dr. Deborah Birx, the coordinator of the White House Coronavirus Task Force, looked quietly aghast, but later said the president was just musing on the subject. The backlash was swift, as Mr. Trump's remarks were pilloried on social media. He walked back his remarks the next day, calling them a sarcastic question to reporters, quote, "just to see what would happen," end quote. The same day, the U.S. Food and Drug Administration and the makers of Lysol warned that the suggested treatments could kill. The British maker of Lysol, Reckitt Benckiser, warned in a statement, "We must be clear that under no circumstances should our disinfectant products be administered into the human body." The backlash even extended to the wife of CNN anchor Chris Cuomo and sister-in-law of New York Governor Andrew Cuomo, who admitted to pouring Clorox bleach into her bathwater as a preventative for COVID-19 infection. Both she and her husband tested positive for the infection. And perhaps as a gauge to the gullibility of some people, New York City's Poison Control Center reported 30 cases in an 18-hour period the day after the president's remarks, with 9 specifically about exposure to Lysol, 10 cases about bleach, and 11 cases about exposure to other household cleaners. According to the U.S. Centers for Disease Control and Prevention, cases of exposure to cleaners and disinfectants have gone up 20% from January through March 2020, compared with the same time last year. Read more of our coverage at able.com. More COVID-19 related headlines. Abled Alert Module. Image. Photo of a bottle of hydroxychloroquine sulfate tablets, 200 milligrams. Hydroxychloroquine arrhythmias in over 90% of cases. The drug once hailed as being a promising treatment for COVID-19 patients is losing much of its luster after 2 studies reveal that over 90% of treated patients developed signs of heart arrhythmias. Hydroxychloroquine, a less toxic derivative of chloroquine, was originally used to treat malaria and the autoimmune conditions of lupus and rheumatoid arthritis, and garnered rave anecdotal reports from doctors in China and South Korea in the early days of the epidemic. Then, U.S. President Donald Trump touted the merits of the early promise, and the FDA gave emergency use authorization for its use in critically ill COVID-19 patients, as it was thought to calm the so-called cytokine storm of an immune system going into uncontrolled overdrive and causing potentially fatal inflammation. But there have been conflicting results from other studies and clinical trials in France, Brazil, and the United States, where the drug either showed no discernible benefit or began to show the worrisome trend of causing the heart to stop beating in time. So much so that the high-dose part of the trial in Brazil was halted because 11 of 40 patients died within 6 days. Yet another anecdotal report from the front lines continued to show remarkable turnarounds in younger patients, especially when the drug was combined with the antibacterial azithromycin and a zinc supplement. In our Video Logs tab section at able.com, Dr. Mehmet Oz spoke with a doctor in Los Angeles who explained how the combination is thought to work. Abled Money Module. Image. A pharmacist holds a box of medication she's taking from a shelf in a pharmacy. Get help for prescription costs. The COVID-19 pandemic is affecting the health of millions of people beyond those who become infected with the novel coronavirus because of medicine shortages. When U.S. President Donald Trump touted chloroquine as a promising treatment, mass hoarding turned from toilet paper to this and other drugs put forward as potential treatments for C19 by doctors who were writing prescriptions for themselves, family members, and friends. This immediately put supplies in jeopardy for people living with conditions like lupus and rheumatoid arthritis. That, in turn, has led to many people dangerously self-diagnosing by self-rationing and stretching the dosing protocols for those medications, potentially putting themselves in life-threatening situations because they can't afford refills. Look for this story in the Headlines tab in the C19 News Logs section at able.com. We've listed a number of resources that you can contact to get assistance with supplies and pricing. Your doctor or pharmacist would be the best place to start, as they may have sample packs available for some meds. They can also let you know of possible discounts or aid programs from the pharmaceutical manufacturers. All information in this briefing is presented for informational purposes only and is not a substitute for advice from a doctor or other medical professionals. All materials copyright 2020 able.com and their respective owners. More COVID-19 related headlines. Abled Health Module. Image. An illustration shows a blood vessel with red blood cells, white blood cells, platelets, and plasma showing. COVID-19 blood plasma needed. 2 weeks ago, the U.S. Food and Drug Administration approved the use of what it calls COVID-19 convalescent plasma for patients with life-threatening forms of the illness. The serum is derived from the donated blood of COVID-19 survivors who have built up antibodies to the SARS-CoV-2 coronavirus. The move came after initial promising results in China, where doctors began using the protocol last month. In the wake of the approval, several organizations have been reaching out for donations of plasma from people who've recovered from COVID-19 infection. They include the American Red Cross, COVIDplasma.org, an initiative of the American Association of Blood Banks, and the National COVID-19 Convalescent Plasma Project, an initiative of Michigan State University. The Bill and Melinda Gates Foundation is serving as an advisory partner, and Microsoft is providing technology, including a website and a plasma bot, for the COVID-19 Plasma Alliance, which sees experts from the world's leading plasma companies coming together to create a new alliance to accelerate the development of a potential virus treatment. The ING in COVID-19 stands for immune globulin, which the COVID-19 Plasma Alliance will use to concentrate the antibodies into an investigational medicine. Microsoft expects to make the bot available through other web, social, and search channels, as well as to maximize awareness for potential plasma donors. Donation should be fairly convenient in most cases. More than 50% of the eligible donor population in the U.S. lives within 15 miles of one of the 500 centers operated by COVID-19 Plasma Alliance member companies. Recruitment will start in the United States and then expand to Europe. Abled Tech Module. Image. Logo icons for Apple and Google flank a smartphone showing an electron microscope photograph of the COVID-19 virus. No tracing app for 2 billion phones. One of the buzz phrases bandied about with increasing frequency during the evolving C-19 pandemic is contact tracing, also called track and trace. Merriam-Webster defines it as the practice of identifying and monitoring individuals who may have had contact with an infectious person as a means of controlling the spread of a communicable disease. But the scale of over 2 million cases of coronavirus infection worldwide obliterates traditional approaches that have no hope of keeping up. Enter modern-day technology. While health authorities around the world have been working to build or acquire third-party apps that can achieve this, tech giants Apple and Google, whose operating systems run on the majority of smartphones, have announced they have been working together to accomplish this at global scale. However, an estimated 2 billion smartphone owners won't be able to use the COVID-19 contact tracing platform being jointly developed by Apple and Google because their phones are too old. Phones over 5 years old don't have the current Bluetooth chips needed to use the app. Most of them are owned by seniors or people living in poverty, so the two groups most vulnerable to coronavirus infection will miss out. Read more on this at abled.com. All materials copyright 2020, abled.com and their respective owners. Abled is a registered international trademark and wordmark of the Laura and Wagner Foundation. All rights reserved. Thank you for listening. We hope this has been helpful in your understanding of the current global COVID-19 pandemic.